I swear to God, it felt like my jaw dislocated. It popped out. I screamed. I mean, it was terrible.
This is Rachel. And what started as trouble swallowing as a teenager,
I felt like I couldn't eat. I felt like I was choking on my food. Like I had a really hard time swallowing food.
turned into a medical journey that literally transformed her face.
My airway was 2 millimeters, and for a normal adult woman, it should be closer to 11.
Inside Rachel's jaw, something was slowly deteriorating.
Your body's breaking it down for unknown reasons. Mine were off to the side, wadded up little balls of trash. Both the left and right disc there have huge holes in them. They were torn open.
So what's the fix? Completely rebuilding her face.
The upper mandible, in order to move that, they actually have to take a bone saw and cut through all of this and then literally move it forward and put those plates in to hold it in space. I had a 1 gram gold weight implanted in my eyelid to close my eye.
But what happens when you wake up with a face that even you don't recognize?
I got a whole new face out of this. My face used to be oval, and now I feel like it's very square. Like this was not my jawline before, not at all.
This is a story about identity, pain, and rebuilding yourself from the inside out.
I had a whole lot of facial paralysis on the left side of my face.
Welcome to Sickboy. Today we are going to be talking about TMJ. I don't know what TMJ stands for.
Teenage Mutant Jaw.
It's definitely not that, but I've always, and Tay and I had talked about this before the recording. Is TMJ lockjaw, or are those separate things?
Those are separate things. So lockjaw is what you get actually when you get like tetanus. But TMJ just stands for temporomandibular joint. So it's actually the joint itself. It's part of the body. But a lot of times people will say, oh, I have TMJ when they have problems with that joint. So kind of the normal use is not quite scientifically accurate.
Okay. So would you have been one of those people that's like, oh, I've got TMJ? Or were you pretty like in the know that you had actually what's referred to as TMJ deterioration? Hey folks, if you wouldn't mind doing me a huge favor and just take a quick second to hit that subscribe button and of course hit the thumbs up button as well. And hey, look, if you don't have time to watch the video right now, I ask that you just take a second to add it to your watch later playlist. It would mean the world to us. And thanks for being here. All right, without further ado, let's get back to the episode.
Well, yeah, I did not know that at the time. I had never heard of it before. And so most of the time when people have TMJ deterioration, it's actually due to a condition. I've heard it pronounced different ways, but we'll pronounce it as idiopathic condylar resorption is actually the underlying pathology.
It's idiopathic condylar resorption?
Yes.
Okay. What the f does that mean?
Well, idiopathic means they don't know why, right? So that's always super gratifying whenever you get a condition with the word idiopathic in it. And condylar is basically the bones kind of, TMJ is kind of like a ball and socket, and it's the bone, the ball part is deteriorating, and it's just resorbing into your body. Your body's breaking it down for unknown reasons.
Whoa, okay.
That's crazy. I never forget what idiopathic means because it just makes me think of idiot. And I just like in my head, I just go, duh.
I mean, honestly,
they
like,
don't know.
I mean,
they don't know
that's
what.
probably, I mean, I'm sure, I mean, obviously the two words share etymological roots. And like, it is, I mean, obviously it's obviously very helpful in science to come up with like a singular word that describes, you know, a bigger concept. But it is funny to use a word that sounds like, it sounds like it should mean that you know, but it actually means that you don't.
It's like idiot pathology, right? It's like,
Yeah.
That's what
I don't know.
I hope if I ever get idiopathic mandibular resorption, the doctor goes, well, you've got we don't know. Your jaw's okay. So I guess Rachel, walk us through your jaw history. How does one even end up realizing that you have TMJ deterioration? I'm guessing that it's not something that's like I'm guessing it's one of those journeys that's kind of a pain in the ass to get to the bottom of.
To some extent, I will say that mine, I kind of skipped a bunch of steps. I'm big on permanent cures. Like if we know how to fix it, let's just do that, right?
Hell yeah.
But yeah, probably in retrospect, I think it started when I was about 15. Because again, they don't know why it starts, but I was in high school at the time, and all of a sudden, one day I felt like I couldn't eat. I felt like I was choking on my food. Like I had a really hard time swallowing food
Huh.
and taking pills and things like that, to the point where I actually went to a gastroenterologist and they did a barium swallow, and that all looked normal, and they basically were like, "Oh, you're just some hypochondriacal teenage girl, you're fine." But I mean, I wasn't fine. I was losing weight. I was having trouble eating. Like I couldn't take large pills. It was not good. But that was kind of the first hint that maybe something was going on in that area.
Huh. Okay, I've got a couple questions.
Mhm.
Firstly, barium swallow. I've had barium rammed up my before.
Yes.
A barium. It's. I mean, they
An
would
enema.
say a barium enema.
Yeah.
I call it a barium ramming.
Yeah. Another way that science has come up with a really nice, concise
Yeah.
word to describe what you said.
But a barium swallow. Did you? Does that mean you have to literally drink like a glass of barium? And if so,
Yeah.
how good did that taste?
Yeah, it kind of tastes a little bit like Malox or something. It tastes like drinking chalk.
Oh, okay.
Yum.
Yeah, I mean
I'm like-
it's okay.
Is it flavored?
Yeah, it's flavored. It's radium
It's
flavored.
chalk flavored, dude.
I think they flavor it
remember
like
it.
orange juice.
I remember it as having again a little bit like Malox, like a little bit of a mint or just something, but it wasn't great. But
It's
yeah,
like they try to make it nice, but it just really
Yeah, they're
sucks.
like, it's really not like
Actually, now that you mention
like
it,
a bad protein
my
powder.
asshole felt pretty minty. When,
that's
when,
nice.
when I
That's
got
nice.
when I got the barium ramming.
I feel like one of the things that just in general from doing the show, I've always been I've for most of my life I've been a person that's like, when I feel something, I kind of just kick the can down the road and think that'll go away, or it's not really anything. Actually, since I've had kids, I'd actually described this to my doctor the other day. I was like, since I've had kids, I've actually kind of like swung to the other end of the spectrum where like when I start to feel something, I actually get really worried about it because I think about my kids and like, what if it's something that's serious? And then what if that impacts my ability to care for them, or if I'm not around or whatever, which is not good either. Both ends of the spectrum, not great. But one of the things that I have kind of become fearful of in doing the show and hearing so many people's stories about their journey to come to something is that so many people have an experience, whenever it is in their lives, but the first time where they think that something's going on and they see a doctor about it. And maybe because you're young or because it's so early in what is ultimately going to present over time, that they're like, meh, not really anything. And like, just to think of like, what would that have looked like if that had been like taken serious, not necessarily not taken seriously, but had been identified correctly, or that some of the signs have been identified that like, maybe it could be this. And if we intervene now, what does that look like for your future versus, properly identifying this 5, 10, 15 years later, which is like, I don't know, just it gives me a low level background anxiety. Like when you think about that and having had that experience, like, do you ever think about that in like the timeline of your like journey of this?
Yeah, absolutely. And I think there's two things to keep in mind with that. One is my age, because, back then it was the late 1990s. And so medical technology wasn't at where it's at now, right? Like back then, if I remember correctly, like MRIs were just invented. They weren't in clinical use. I mean, the tools were a lot more limited back then. So that's one thing. And then the other thing is I grew up in kind of a podunk area in Ohio, and a lot of the medical care I got then in retrospect was not as good as you would get if you were in a major city with an academic medical center. So related to that, like I remember going to the dentist when I was a kid, and I was at the age where they assess kind of if you need braces or not. And I remember the dentist coming in and asking me like, okay, so you have an overbite. So do you feel like your bottom teeth are going into the roof of your mouth? And I was like, no. And they're like, well, then she doesn't need braces. And like, that was the end of it. And that's probably not an acceptable standard of care.
I'm one thing that came up when you were explaining the early days of this is that you found it hard to like swallow pills or swallow. That that sounds odd to me. Like, when I think of a jaw problem, I think of, maybe pain in your jaw, in your head. Maybe, the inability to open your mouth wide, or like having issues with like speaking or something. That all makes sense to me. But the trouble swallowing, that seems like a different issue. It seems further down from the jaw. Can you explain to us what's happening there? How is it that your jaw and its inability to work properly can affect the way that you are able to swallow?
Sure. So if you think about it, and I don't know if this will be easy to do, but from the side, right? Like your TMJ is right here. So when this jaw deteriorates, basically your whole jaw, your whole lower part of your face recesses back. Like it all literally comes back and puts more pressure on your airway, right? On your esophagus. It literally like compresses it down. And so that's another thing is like in high school and they used to do the presidential fitness test here in the US. I could never run a mile, like never in my whole life. I felt like I couldn't breathe. When I was a kid, they thought I had exercise-induced asthma. And I think again, it was that pressure. It was literally kind of collapsing my airway as all that tissue came back.
That kind of makes sense to me because if you think of it, and I don't know if this analogy works, but if you think of like a door hinge, and like if the door hinge isn't tight and it like has some wiggle room, then when it opens and closes, it like rubs against the wood on the inside. And so like with your jaw, if you're like everything that's being sort of like held together at that hinge point is like getting a little bit loose or like not fitting perfectly tight and moving in the way that it should, then like it's putting all this pressure, as you said, Rachel, like on the back of your throat and like in that area.
Right.
And that
Right.
now like in my brain, I don't know if that's how
And
it works,
swallowing
but
is
that
like,
makes sense
and
in my
swallowing
brain.
is like one of those things that you just take for like you do it. So, I mean, how many times do you swallow like every day? Like make that action. And so it's very easy to take that for granted. But if you stop and think about it and like you think about how it feels to make that action, like all the different components that are going through some sort of like tiny little mechanism of action to make that happen. It seems very simple, but then when you think about it, like you can feel your jaw, you can feel like all like the hinge of your jaw and all the like muscles in your throat and your tongue and all the, like it's
I hate when
complex.
people make me consciously think about like subconscious behaviors that you do, like breathing or like swallowing and stuff like that. As soon as I start to like draw attention to it, I'm like totally uncomfortable.
Well, I want to congratulate all of us right now for not making some juvenile joke about swallowing. When you said that.
Yeah. We're not gonna go there.
You just brought it up.
I didn't think of it.
But we're going.
I just realized it didn't happen.
We're forging forward.
Congratulations.
We're passing right over it. Is the presidential fitness test? Is that a fitness? Is that like, hey, this is what we make the president do when they come into office?
Did you not do the?
This is what you have to do.
You didn't do the prime minister fitness test growing up?
I don't recall.
Oh, that's weird.
Yeah, that was a thing in the US back then. You had to do pull-ups and climb a rope and run a mile. And I think
'Cause the
Arnold
president could.
Schwarzenegger
You must be as
promoted
fit
it.
as Biden
Yeah, because we all know
or Trump or anybody.
I mean, hey, listen. At that point in time, my guess would be we're talking Clinton,
Bill Clinton,
maybe.
yeah.
Clinton. I'm sure Clinton was climbing ropes and,
He
and
was
doing jumping jacks.
He looked like he was
Guy
probably
could blow. Guy could play a sax. So probably
That's
something you
true.
can't do with TMJ deterioration. Okay, so take us through then the moment of coming to realize. Basically getting your diagnosis. Who gave it to you, and what did that look like once you got the diagnosis?
Well, kind of what got me there was a couple things. First of all, I did start to have pain finally. A couple incidents, but the big one was one night I was trying to fall asleep and I was sleeping on my side. And right as you fall asleep, your whole body kind of goes limp. And when that happened, I swear to God, it felt like my jaw dislocated. It popped out. Yeah, I screamed. I mean, it was terrible. It was an immense amount of pain. And then, of course, like you're not going to go to sleep again anytime in the near future after that happens. Because, of course, every time you're about to fall asleep, you're like, like it's terrifying. So after that happened, I did have a lot of ongoing pain and very limited mouth opening. And so that's when I was like, okay, I've probably got to do something about this. I didn't know what was going on. And I happened to have Botox set up. At the time, I was getting some Botox in my forehead. And I did some Googling real quick, and I was like, okay, well, masseter Botox for TMJ dysfunction is a thing. So I'm
Mm-hmm.
just going to ask the doctor if she can do my masters while I'm there. And she did, and it worked. And so a couple weeks later, I was again falling asleep and my jaw popped back in. And that's kind of when I was like, yeah, I've definitely got to do some research and see if I need to see a dentist, an orthodontist, a surgeon, like who does this basically.
And who does?
Yeah.
Well, the correct answer is you probably shouldn't go to a dentist. I don't want to get hate from the dentist out there, but
They already
know,
hate us. We don't brush
yeah.
our teeth. We don't floss. They hate us.
Yeah. We rarely
Yeah.
refer to them as doctors. It's
Yeah.
really, they're
Yeah.
really upset about it.
They're basically glorified vets.
Yeah. Well, I love my dentist. She does great things for my teeth, but she is not an orthodontist, right? So
We'll cut that.
yeah. Cut that, we'll cut that out, yeah.
but I actually did get referred initially. I called a maxillofacial surgeon. My research said, hey, you should see a maxillofacial surgeon. I called the only maxillofacial surgeon I could find in town. Because again, I live in not a major metropolitan area, so there's one. And they said, we don't touch TMJs. We don't do that at all. There's one dentist in town who's a TMJ specialist. Go see him. And if he can't help you, there's a maxillofacial surgeon 3 hours away in another part of the state. He's the guy. So that's what I did is I went first to see the dentist in town. And he clearly fits a lot of people with splints, like mouth guards that are supposed to fix your TMJ issues. So I saw him, he did the imaging and all that. And again, being a forensic neuropsychologist, I think I maybe just come off as a little bit more no bullshit than the average patient, because at the end of that appointment, he told me, he's like, look, I can give you a splint. It's going to cost $3,000. It's not going to fix your issue and you're going to have to wear it forever. I was like, all right, peace out. So I went to see
Right.
the
Wow.
And
surgeon.
he's like, and I promise you, I'm not a psychopath or a sociopath, and I don't
Yeah.
have.
And you're like, well, you have complex
Sorry.
trauma, and that's actually going to cost you a fuckload of money too.
How would a splint, because like, like if it's not, if it's deteriorating and it's not like fitting well, like how would a splint in theory fix that?
Well, I don't. So the imaging he did, and I'm a little unclear about this because I'm not a dentist, but I think it was some sort of CT. I think it was like a cone beam 360-degree image. And he basically was like, well, you might have a bone spur in this TMJ. And that was all he could tell me from it. And so he didn't really catch that the joints were deteriorating. And theoretically, the splint, like the TMJ is a very complex joint. In addition to that ball and socket, there is a meniscus in there, right? There's a disc. So your TMJs and your knees are the only joints in your body that are like that have that disc. And so most of the time, if a splint works for somebody, it's helping that disc kind of stay in place and taking the stress off of that. But again, it's probably not going to fix it. It's just going to be kind of an aid to keep it from maybe deteriorating as quickly if you're not
Okay.
tearing that disc up every time your mouth opens, kind of thing.
How did you get to the point where they were like, you know what? Actually, we need to do a bunch of wild surgeries to your face.
Yes. So this is, like I said, I'm a fan of the permanent cure. So I go up there and I see the surgeon in the whole other part of the state because we only have one here. TMJ surgeons are rare. There's actually only so many in the US. It is growing, but it's not a relatively new surgery, but it has not been common until recently at all. So I go up there and every surgeon, they have their own imaging protocol they want. I have the special MRI where they MRI your TMJ. So they do it mouth open with a bite block, like a little piece of foam, which is super comfortable when you have TMJ problems to leave your mouth open for like 45 minutes while they do this MRI.
Ugh.
Yeah. And they do it closed. And then they send that over to the surgeon. It's a series of appointments. You have to do the background paperwork. You have to do the imaging. You have to have a bunch of measurements and pictures taken, all this stuff. And so by the time I finally got to see the surgeon, they put the MRI up on the screen and they show me my joints. And that ball and socket, it should be smooth, right? Like everything should be going great. My bones, my joints, they look like a bowl of popcorn.
Oh,
I mean, there
Whoa.
was nothing smooth. And then the discs were not in place. They were literally wadded up little balls off to the side of my joint. They weren't in there at all. So it was bone
Wow.
on bone, just
Is it
grinding.
like a is it like a type of arthritis? Like that's kind of what it sounds like the
It's
description of
idiopathic.
it all?
Oh, we don't know.
Yeah, no, I know, but like what's actually like not necessarily what causes it, but like what then is actually happening. Like it sounds like an arthritis where it sounds like an arthritis, yeah.
You actually the bone deterioration isn't necessarily, but you can have arthritis in there as well. And you can, if you don't have like idiopathic condylar resorption, another common reason for TMJ replacement is actually like rheumatoid arthritis, juvenile
Mhm.
arthritis, things like that, that can attack those joints as well.
Hmm.
And when you say that when you say that you're like a fan of this permanent cure, like in your experience, is that like when you say that, does that look like in the medical world the healthcare system being like, okay, well, before we get to this, you know, big thing that, you know, we're gonna try like ABCD thing first because we don't want to rush straight to this big thing. We want to see if we can do these smaller things, maybe less invasive, see if
Yes.
that works. And then if we need to, we can get to that big thing later. And you're more like, no, this is I just want to go straight to the fix me forever plan.
Exactly. Yeah. Because I'm, from my perspective, I'm kind of lucky in that regard that my discs were complete trash. Because if my discs were still okay and they were just permanently displaced, a lot of people actually have the discs move back into place and like sutured in, or there's these little things called MyTech anchors and things like that where they can try to preserve your discs. And
Mm.
sometimes that works and sometimes it doesn't. And sometimes, 3 years later, you have to have the TMJ replacement anyway.
Yeah.
Hmm.
Sometimes they do PRP injections. Sometimes they go in and like shave the bone down and this, that, and the other. And I'm like, that all sounds really painful and it
Hmm.
could not work at all. It could last 6 months. We don't know.
Hmm.
And there's some research out there now showing that the fewer procedures you have before you have your TMJs replaced, the better long-term outcomes you have in terms of reduced pain.
Ah, okay.
Interesting.
is there any part of that too that is, and just wondering maybe in because it's different in the states with private healthcare, like is there any worry that cost over time of like trying these other things first will just keep adding up when like maybe it makes more financial sense too to
Or in the
like go
inverse, being
yeah
like, let's do this smaller thing that costs less, and fingers crossed that will fix it, and
yeah
then we won't have to like
Right.
pay anymore. I guess it could
Well,
go both ways.
yeah, that's something we haven't gotten into. So most of the time, if like the dentist gives you a splint for your TMJ, you're paying cash for that out of pocket. That's not something that's covered because it's not an empirically supported treatment. So that's another reason I skipped all of that because I'm not going to give somebody $3,500 for something that probably won't work.
Reminds me of the vet.
Yeah.
Just saying.
Wow, shade thrown.
But then in the US, another thing is that, our healthcare insurance and our dental insurance is separate as it is in most countries, right? But most health insurance will say TMJ is a dental problem, and most dental insurance says TMJ is a medical problem.
Mm,
And so it
mhm.
is usually specifically excluded. So as part of all this, I go up there and I see the surgeon the first year. Luckily, with the Affordable Care Act, I knew that the plan I was on at the time, it did have a TMJ exclusion.
Mhm.
So none of this was going to be covered. So I paid cash for all those initial appointments. And then when the calendar year switched over, I switched to a different insurance that did not have a TMJ exclusion so that I could get the surgery
Mm.
covered.
So I have a number of photos that you sent me. Maybe we could walk through this and kind of I guess walk us through the process of what surgery looked like. Pre-surgery, during surgery, and then and then all the other things that came after that. Because it didn't seem like it was very straightforward. Right now we're looking at some pre-surgery photos.
Mhm.
The one on the left here I'm taking it is your face prior to going through any of this.
Yeah, so you can see there that my chin was much further back and my face wasn't as square as it is now. I had an oval face before surgery and now I have a much squarer face. But yeah, that's what I looked like before. I got a whole new face out of this.
For anyone who
Crazy.
doesn't know what mewing is, that's a
Mhm.
that's an epic
That's
mew
mewing.
right there. And then so you've got the on the right there. We have
Mhm.
that's an MRI. I take it.
Yes.
And what is that? What's going on there?
Yeah, so that's the MRI I had done of my TMJ, and I actually added those little measurements in. I look at imaging sometimes as a neuropsychologist, so you can see there that that little 2 millimeter line, that little skinny line, that was how big my airway was before the surgery. So
Hmm.
that's actually how we got insurance to cover it, is my understanding, is not so much that it was a TMJ issue, is that it was orthognathic
Mm.
surgery for my sleep apnea because everything deteriorating and pressing on my airway gave me sleep apnea. So I was
Hmm.
sleeping with a CPAP for about a year before surgery.
And for the
Did you
folks just
snore?
listening that not watching, we're looking at an MRI, which is the profile of your face. We can see man, MRIs are wild. They can see your brain. We can see your sinuses, your throat. It's your entire head. Look at the tongue, guys. Like the tongue.
Yeah.
How wild is the tongue? Like that is just so crazy. This entire thing
Just looks like it just makes a sound. Blech.
yeah,
Yeah.
it looks like a giant sea cucumber.
Yeah,
just,
it's a
just
big
mashed
mollusk.
into a face. Yeah.
Mhm.
So the airway here, I take it like it's quite narrow compared to what it should be. Is that correct?
Correct. Yeah. So my airway was 2 millimeters, and for a normal kind of adult woman, it should be closer to 11.
Oh my fucking
Whoa.
holy
Wow.
smokes!
That's significant.
Wowee. Okay,
So
and
that's
then
why I
in the
couldn't run
center
the
here.
mile.
Sorry, go ahead.
Yeah, that's why I couldn't run the mile. Like I used to be an avid CrossFitter, and even then I couldn't run a mile. It's because I
Wow.
literally was like working out through like one of those little cocktail straws, basically.
Oh my
Wow,
God.
yeah.
That sounds really horrific.
What-
Can't
was it-
can't be as fit as a president with the two centimeter.
Was it kind of validating, Rachel, to see this and be like, I knew it was much higher. Like, did you did you always know that it was like this much smaller?
Yeah, I mean, I didn't know why, but I knew it wasn't normal that I couldn't do those things despite how much working out I did. In fact, as an adult, when I got good health insurance, I went and I had a breathing test done, like a pulmonary function test and everything, because I was like, okay, were they right? Do I have some kind of asthma? Like, what's going on here? And all my breathing tests, believe it or not, came back normal. So I knew it wasn't like
Wow.
I knew
Hmm.
it wasn't in my lungs, so I was like, "Well, yeah, I don't know." So, yeah,
Mhm.
actually seeing this MRI for the first time, I was like, "This explains so much."
Yeah.
Because it's not normal to be an adult and have to ask for, like, liquid antibiotics because you can't swallow the pills.
Goodness
Wow.
gracious.
I mean, it
yeah.
is crazy to think that space should be 5 times
Yeah,
bigger.
wild.
Yeah.
So the other image here is the implant proposal.
Yes.
Which for folks just listening, it's 3 slides seeing the left profile, right profile of the jaw, and a sort of front on image of the human jaw. Looks like a 3D rendering of some sort.
Yeah. So there are 2 different options right now for TMJ replacement. There are stock joints, which they're pre-made, they're off the shelf. If it's an emergency, you can get one in a pinch. And then there are
Who
custom
makes them?
joints.
IKEA? What's the
They're good with
Yeah.
those.
Yeah. Comes with all the
Uh,
hardware and an instruction manual.
Yeah, I think it's Biomet actually makes the stock ones, and then Stryker makes these custom ones. And so mine
I
were
know
custom
Stryker.
joints. So as part of this process, once you say, hey, we're going to do this surgery, you have to do 2 things. One is you have to go into orthodontics because if your teeth are not in the right place to begin with, when they start moving the pieces of your face around, the teeth could actually block them from moving it where they need to move it, right? And so they need to move your teeth ahead of time to the proper space so that they can move your jaws to where they're going to be.
wow? Okay,
Oh
so
man, that's crazy.
Yeah.
So you had to so back to the dentist.
Mm. Yeah, so I actually, my surgeon had me go to a specific orthodontist he wanted to work with, and I was in Invisalign for about 8 or 9 months before the surgery to get my teeth to where they needed to be.
Jesus.
Did you
Yeah.
like Invisalign?
Well, as we talked about earlier, I never had braces as a kid, so I will say it was a hard adjustment. Like, I didn't know it was going to be that brutal because they're kind of marketed as like, "Oh, it's so easy." Like, no. I had 16 attachment points for my Invisalign, and so it was a very sharp and painful road for those first few months,
Wow.
especially.
So this next
Was yours painful, Brian?
Probably not to the same extent. It's like I felt like my teeth. The only way I can describe it is I felt like my teeth felt bruised. Like I would put in so
Yeah.
every week you like change the size or shape or whatever.
Mhm.
And
regular
and-
braces are like that too. Every time you get them tightened.
when they're moving, it's like you just feel like even when you bite on something, it just feels sensitive.
Mhm.
It's funny.
But
I liked that feeling for some reason.
I
Well, you're a
actually
masochist.
liked I enjoyed having them in. There was
Yeah.
like some sort of like feeling of comfort in having it. I don't know. It's weird. It's really hard to explain. But I also didn't have TMJ.
So what we're looking at here now is a series of photos. So we have the left TMJ and the right TMJ, and then we have new left side and new right side.
Correct.
Walk us through what are we looking at on the left here?
So on the left, that is actually the left. We talked about idiopathic condylar resorption. That's the bone. That's the condyle or condylee or however you pronounce it. That's what they
Whoa.
cut out of the top of my jaw.
Whoa.
And then the thing next to it is that meniscus, that disc. So like I said, mine were off to the side, wadded up little balls of trash. You can see that both the left and right disc there have huge holes in them. They were torn open. There was no,
Holy
even if they
shit.
hadn't been displaced, there was no cushion left to be had.
Wow.
And
Wow.
is that and the images on the right, are those your images?
Those are my images after surgery. Yeah. So those are my new babies. That's my new joints.
Oh yeah. I mean, you can really see it from the MRI image, just like how far back your chin was versus
Right.
those like bone images. Those
Yeah.
new ones. That is a
Whoa,
crazy
yeah.
difference.
Well, and that's what we haven't talked about yet either, is if you look at those images, you can see it's not just new joints. You can see there's some hardware along here,
Mm-hmm.
and those are little plates. So in addition to the TMJ replacement, in order to get my jaw aligned like it should be, to clear out my airway, to get everything at the correct angles, right? Because there are scientifically kind of optimal angles. They also had to do what's called a Lefort 1 segmental osteotomy.
Oh,
So-
Jesus, what?
You
Yes,
mean like
exactly.
scientifically optimal angles for like beauty, like proportions. So like when someone's looking at you, they're like, "This is the golden ratio."
This is
for your
the
face."
optimal mewing. Yeah.
Man, let me tell you, I wish there was any cosmetic aspect to this because they go in and they're like, we're going to change your whole face. And by the way, we can't tell you how you'll look afterwards or if you like it or not. So,
Is that
Wow.
scary?
yes. Yeah.
Yeah.
Yeah. You can see pictures of people before and afterwards, usually because of that great jawline. You see it and you're like, oh, that looks better. But like, there's no guarantee,
Right.
of what you're going to look like. They don't show you. It's not like a plastic surgery office where they show you like, oh, you should look like this afterwards. No, there's none of that.
Right.
So,
And what does that feel like I would imagine because the difference is quite stark,
mhm.
but between the before and after in terms of like where you kind of notice it by the position of the chin mostly.
Yeah.
Like, what does that do for like the whole system around that? Like, I mean, like your whole face is in like a totally different position. Like, does it mess with like the muscles in your neck or
Oh, yeah.
or anything like around there when like your face is just in a different place?
Hugely. So, I mean, even the Invisalign, I had to go get weekly massages at first because I was in such an immense amount of muscular pain just from changing my
yeah.
bite every week. And
Yeah.
then after surgery, once I was out of it enough, I was out far enough after the 6-week mark or so, I, on my own accord, started going to PT and they did a lot of massage and dry needling because those muscles were just little knots. And so I had to have, especially this left side, dry needled every week for quite a
Oh,
while to
goodness
get it to
Dry
let
gracious.
go.
needling is
it just sounds awful.
yeah, it's like they stick it in.
Ugh.
Have you ever had it?
No, I know what it is. Yeah.
They put it in and they like
Yeah.
Yeah.
and sometimes they
Yeah.
yeah, and sometimes they attach an electrode
Okay.
thing
For
to
God's
it
sakes, no.
to stimulate it, and sometimes it's just the needles. But I mean, I've had both. It's super uncomfortable. I had it in my groin.
Okay.
It was
They're kind of
awful.
just like, come here, blood.
Yeah.
Come here, blood. Come.
So this one here is pretty cool. So this is like a panoramic view front on, and you can see the two implants on the sides.
Yes.
Also, so is there, when I'm looking at your, like above your teeth,
yes.
like in your sinuses there, is that your body, or is that some foreign object too? Because it's so
Yeah.
hot,
It's like
like
you have
white hot.
like bike chains in the back of your mouth.
Right. Yeah. So that's the hardware from the Lefort 1 segmental osteotomy. So, you know, your lower mandible is kind of attached through those TMJs. So the TMJ replacement is moving your lower jaw forward. But the upper mandible, in order to move that, they actually have to take a bone saw and cut through all of this and then literally move it forward and put those plates in to hold it in space. And then the bone has to grow in the new position.
Wow.
So they moved my upper mandible forward almost a centimeter.
Wow.
Man,
Yeah.
there's just
Holy.
like so much more cringy body response to face stuff
Yeah.
than
Yeah.
like, you know, if
Yeah.
it was my leg or if it was whatever, any other
Yeah.
part of your body. I
Yeah.
mean, there's some
You
parts
guys
of your
remember
body,
when
some parts that would be very cringy,
I've-
but like this is particularly
This looks like my Instagram did when Jared took my phone for a couple days and just liked teeth photos on my
Yeah.
entire Discover
Yeah.
page.
it's actually
was
a
just
really
teeth.
great prank. You
It
take
is.
somebody's phone
Yeah.
for just like a minute a day
You
when
just
they're not
follow
around.
hashtags, dental hashtags. That's it.
Anything
That's
that
great.
you want, any crazy thing that you want, just go and start following a
Fuck
bunch of
their
crazy
algorithm.
accounts, and then all of a sudden, everything that they're seeing
I
is
couldn't
weird
understand
thing.
why I had so many teeth in my
There's a lot of
Discover
teeth.
feed.
a lot of
So
teeth.
this one here, we've got an image of your teeth with these like hooks on them. Is that was that for the Invisalign, or this seems a little more? I mean, it looks like you have thumbtacks in your teeth.
Yeah, I know. So that actually wasn't for the Invisalign. So that was after they had taken off the attachment points for the Invisalign. A couple days before surgery, they asked for my orthodontist to put these surgical hooks on. So if you have like normal braces, like wire braces, they can use those as hooks to keep your teeth closed during the surgery. But with the Invisalign, I had to get those surgical hooks put on so that they could basically wire my mouth shut while they did the surgery and move my jaws
Wow.
around to keep everything
Wow.
stable. So yeah, that was a rough couple days sleeping with a CPAP mask on
Right.
directly over those hooks. That
Oh my god!
shredded the
right.
inside of my cheeks a little bit.
And
Oh.
I see this image here. There's they gave you what, like a vodka crayon shot beforehand just to ease your nerves.
Yep. That's what it
Oh,
looks like.
that would have been nice. But no, so as part of this, I also had a deviated septum. So they did a septoplasty because to do the Lefort osteotomy and all that, they break your septum anyway, your vomer bone in there, right?
Oh my
Yeah.
goodness,
Yeah.
Rachel.
Oh,
Yeah.
sounds like the vet. Yeah.
Yeah, so they broke
While
that
you're here.
bone. And that was the first blood that they suctioned out of my nose the next day. All of that came out of my sinuses. So
Oh, my god, you were bleeding vodka crayon?
okay, here's the fun thing too, is the surgeon, bless him, he injects a numbing agent in your face to reduce your pain after the surgery, right? So for the first like 3 days, I couldn't feel my face after surgery. And the whole time I just had blood like running from my nose. And I couldn't
no
feel
shit.
it. I had no sensation at all. So my poor boyfriend was just like wiping my face for me with a wet
well,
rag for 3 days.
Yeah.
Whoa.
So
Wow.
this is your
Whoa.
face
Yeah.
after surgery. Pretty wild photos. I mean, for the folks just listening, and highly suggest you take a moment to head over to YouTube to take a look at these. You really did kind of track the progress. You have day one,
Yeah.
where you look like, well, you know what? I have Shrek playing in the background here because it's kind of like, it reminded me of Fiona, after she turned in, like you were the beautiful princess, and then you have the surgery, and now your face is just, I mean, your head turned into a basketball. It's wild.
It's puffy.
Yeah.
And then you have a day 4 and a day 6, which actually the progression just over those 6 days is quite miraculous. But take us through what we're seeing here.
Yeah, that day one, I think I look a bit like a Cabbage Patch doll that somebody beat up, you know?
Yeah.
Yeah,
Yeah.
that's exactly what it looks
do.
like.
Yeah, and also, why did the doctors beat the out of your face? Like, did they just punch you in the eyeballs? Like,
Yeah.
what's going on? There's so many. You have black eyes. You have bruising all over your face.
Yeah. Well, I think the black eyes are really from that, septoplasty, from
Right.
you break your nose, right? It's not a gentle
Right.
procedure any way you cut it. It's a pretty bad black eye situation. And then the bruises on my jaw, it's really interesting because by day 6, I was like, these look kind of like handprints, like,
Oh
and
my God.
I know any orthopedic surgery is not a
Oh,
gentle thing. And so I
yeah.
started looking up videos as to how they
Yeah.
actually, you know, break that upper mandible off of your skull. And it
Oh
Yeah.
my
turns
God.
out they actually do in some situations. I don't know if my surgeon did exactly this, but they actually do take their hands and push down. And I think those
Ooh.
might be his handprints, but I'm not sure.
I mean,
Oh
have you
man.
guys? This is a YouTube rabbit hole that
Yeah.
I fell down once. But like, have you ever watched orthopedic surgeon videos? It
You've
is
sent me one or two
it is
over the years.
bananas. It's like I watched one not long ago of a doctor. I think he was working on like someone's leg or knee or something.
The hammer.
And yeah, and it's like he's going to batting practice on this giant like
Yeah.
X fix, and he's trying to beat this thing like in and out of this guy. And I mean, you're right. Like it's not gentle. It's comical. Like
It's like when I
Yeah.
had my wisdom teeth removed though, and I was awake, and they just like he just has basically pliers and is pulling the teeth out of your head. It's and they're like pushing on your face. They're like
Oh my
pushing
God.
against
Mhm.
it as they're pulling.
So day 4, you can start to see the bruising kind of get a little more like obvious, and then of course by day 6, I mean it looks like someone just like was trying to choke you to death around
Yeah.
your neck and your throat. Pretty wild stuff.
Yeah.
Now this is really interesting. So
Mhm.
we've got some more post surgery photos. And each photo, you're it's like your own little memoji. One where you're
Yeah.
blinking, or at least trying to blink. One where you're smiling, and one where you're squinting. Walk us through why you took these and
Mhm.
what's going on here.
So the good news is that nowadays with these surgeries, they actually do facial nerve mapping. So you got, a bunch of different facial nerves, and the big one we're worried about here is cranial nerve 7. And so they map it so that they make sure during surgery that they don't cut it. Because if they cut it, you could have permanent facial paralysis as a result of that. But all that trauma and all that swelling causes damage to the nerves still. Basically, the swelling stretches them to the point where they quit working. And for most people, it is temporary, although it can last a long time, but it could also be permanent. That's rare, but that's a possible side effect. So I came out of surgery, and it took me a day or two to be coherent enough to realize it. But I came out of surgery with a dense seventh facial nerve paralysis on the left side of my face.
Mm.
On the right side, the only thing I had is that my eyebrow wouldn't go up. Everything else worked fine. It would go down the whole bit. But on the left side of my face, my eyebrow would not move at all. As you could see, I couldn't shut my left eye completely. I had partial paralysis of that eyelid. I couldn't flare my left nostril. And then in terms of my mouth, I could smile out, but like I couldn't raise the lip up. And
Mm.
so I had a whole lot of facial paralysis on the left side of my face.
And how are you sleeping? I'm assuming
Mm.
drugs.
Well, you're supposed to sleep on like a wedge pillow to reduce swelling. So I was trying to do that, but I've always been like a side and stomach sleeper.
Mhm.
So that lasted for me maybe 3 or 4 days, and then frankly, I just slept normally and dealt with the swelling. But it's not comfortable. But
No.
No
luckily, I'm
shit.
like a world class sleeper, so it wasn't a huge problem for me.
I feel you.
Nice.
Were you eating like were you on a liquid diet for a while?
So that's the interesting thing. I was not. A lot of surgeons who do this surgery actually do wire or band their patients shut for a while afterwards. My surgeon does not do that. So I basically was, well, okay. So after any major dental surgery, you're not supposed to drink through a straw, because if you drink through a straw, that suction, that pressure will dislodge the clots, and that'll screw up your
Whoa.
healing.
Wow.
So I wasn't allowed to use straws at all. So for the first couple days, I was eating and drinking with a spoon. And that was partially because I couldn't feel my face, right? Like I couldn't,
Yeah.
drink from a cup because I couldn't feel it. So I was eating and drinking very, very slowly, but I was allowed to soft chew. Basically, anything that I wanted to eat that wasn't like, a handful of nuts or a jawbreaker or beef jerky or anything crazy, I could eat.
Mm.
But it was very self-limiting because with that Lefort osteotomy, I called it a segmental osteotomy. So that's the other thing they did is my upper palate, they actually cut that into 3 pieces and expanded it and put bone graft in to make
Man.
that bigger, to make more room for my tongue. So whenever I
Wow.
would chew, if it was too much, if the food was too hard or if I was chewing too much, I could feel the whole thing kind of go like squish, squish, squish because that bone
Ugh.
graft hadn't solidified yet. And so at that point, I
This-
would stop.
This
Wow.
reminds me of when I think
The
it was
substance?
20. Oh yeah, I think in 2013 or 14 maybe, when snowboarding in BC, me and a couple friends, Brian's brother and another guy, and on like day 2 or 3 of a 7-day trip, I hit something and I slammed my knee into my face, like I buckled my body, and I had to go to the hospital and get stitches all over my face, but I chipped like 10 teeth. And I continued to snowboard, even though I definitely had a concussion. And we're in this like really small town, and we were staying at a Super 8 motel, and it was super small,
Very ritzy, very ritzy.
very,
hotel.
very ritzy. And it's a super small town in the city center. I mean, we're talking like a gas station, a couple motels, and like a few chain restaurants. And a Denny's was right beside us. And I just tried to continue eating like sandwiches from Denny's, and like I couldn't, because I was like, I really just don't want to get like soups, even though that was for sure what I needed.
It's
And
just not filling.
it
And also
hurt
the food is so good there.
so right, yeah. And it hurt so bad to I could only open my mouth like an inch to get food in, and then chewing, and oh my god,
Rachel, you thought you had it bad.
yeah.
This guy had to eat at Danny's,
Yeah.
for God's sakes.
Oh my god, it just brings me back to that experience of like how sensitive and like horrifically painful my jaw was.
So, okay, this is really interesting. So now we're looking at photos pertaining to what's called a gold plate. Is okay? So A, is this gold plate thing related to the facial paralysis? And B, what is it? What are we looking at?
Yeah, so basically, when I couldn't blink that eye, that was a huge issue. I have dry eye to begin with, and so when it wouldn't close, I mean, just imagine, just hold your eye open for like a minute or 2 and just see how dry and painful it gets, right? It's horrific. And if your eye gets too dry, you'll start to get corneal abrasions and stuff like that, which can have permanent scarring. I mean, it can affect your vision permanently. You can go blind from that. And so I was very aggressive about that. I went to see the eye doctor immediately, went to see an oculoplastic surgeon. And because I had such severe dry eye to begin with, they went ahead and they're like, hey, let's just jump straight to putting a gold weight in your eyelid so that your eye will close normally. So I had
In
a
your eyelid.
1 gram
Wow.
gold weight implanted in my eyelid to close my eye.
Wow, a 1 gram gold weight will.
Mhm.
Why do they use gold? Do you know?
I think because it's biologically
It's fancy.
inert, it's not magnetic. So yeah,
Oh,
you can actually have platinum. Platinum is lower profile.
wow. So, okay, so we're looking at photos now of the gold weight removal. You can
Mhm.
see the little weight. You can see your eye. I mean, the recovery photos here are, they look, it looks pretty speedy.
Do you get to keep
Um,
that gold?
I did. I have it. I
You
have
make it
it.
into
Yeah.
anything, or
So I might put it on a necklace chain or something eventually. But
Yeah.
yeah. So I had that gold weight. I had it from month 1 to month 7, I believe, after my recovery. My eye was not closing normally for 6 months.
Whoa, you
Wow.
had that thing in your eyelid for 6 months?
Yeah.
And does it keep your eye
absolutely.
closed?
Wow.
Like the whole time?
It makes it. It's funny because actually, when you first get it implanted, you have to work a lot harder to open your eyes. So I just walked around for a week, like, because it's trying to adjust to having that extra weight. So that was spectacular. Let me tell you, I wasn't self-conscious at all during that. But no, it over time, as your muscles adjust, that eyelid is a little droopy because there is a little extra weight, but you blink relatively normally.
So after
What's
the
crazy is I just want to say, like, we've been looking at the photos for so long, and then we just came back to your face and like seeing you now after like seeing all those photos and the things that you went through. It's like you look like you would never know.
Yeah.
Right.
Well, I
that-
mean,
that
so to that point, like, I'm guessing whenever you have any, I mean, if you have any kind of facial surgery like this, it's got to have an effect on the way that your face looks, especially if you're moving the mandible around and implanting things. So, like, compared to prior to the surgery and now, how much has your face changed, and how?
It's interesting because obviously I have a different take on that, I think, than everybody else. Everybody else is like,
Sure.
oh yeah, you still look like you, but I think it's completely changed things. Bringing that upper mandible forward has changed my nose. Like, I
Mhm.
feel like it looks wider and like the tip of my nose looks lower. So I feel like I have a whole different nose. And like I said earlier, my face used to be oval and now I feel like it's very square. Like this was
Mm.
not my jawline before, not at all. So
Mm. Yeah, interesting. It's very rare in any RPG where once you've made your character that you get to go back and change the appearance of your character. And you've somehow found the cheat code to just alter your character halfway through its campaign.
It's also just like a trippy experience to, like, obviously there's so many things, psychologically that you tie to the appearance that you have and how you've known yourself for so long. And even a difference that, I mean, you can, this is present in so many ways. Like,
Even a haircut. You get a haircut and you're like, holy shit.
Yeah, exactly. I mean, Kyla will get her hair done
Yeah.
and come home and be like, so?
Yeah.
And I'm like, yeah, I guess it's a little more blonde, I
Yeah.
think. And she's like, but
if she
to
came
her,
home and she shaved her head, you'd be like, whoa.
but I mean, even
you
just
know?
minor changes, like to
Yeah.
her, it's like, it
Sure,
feels like
Yeah.
this,
Yeah.
Yeah.
it feels
Yes.
so
Yeah.
obvious. And
Yeah.
to most people around, it's almost unnoticeable.
Yeah.
I mean,
Yeah.
That's a unique situation though, because you don't really pay much attention to
To any-
Kyla.
to
and
any-
so
yeah,
it's like
yeah,
you
to
need
anything
be-
at all, really.
You're just a
Yeah.
bad partner.
Yeah.
But like when you're on a Zoom call or something and you mirror the video and you're like, whoa,
Yeah.
like
yeah.
like
Mhm.
I look weird,
Yeah.
but like to anybody else, you probably just look totally
Mhm,
normal.
Yeah.
mhm.
It's very
What
strange.
would you say? Sorry, go
Sorry,
ahead.
I was
Yeah,
just gonna say, I feel like it's like being 13 again, where you're like, okay, well, I want to get my hair cut like this. Let's see if it looks good or not. I have a whole new face, so now I just go to the hairdresser and I'm like, eh? Like, what do you think? I don't know. Like, I don't know what's going to look good
Right.
now.
Right.
And so
Yeah.
it's really, yeah, I mean, I'm trying to change everything so that I like my new face, if that makes sense.
And
And do
how
you
long
like
ago?
your new face, or do you feel like, oh, I miss my old face? Like, was it a positive change, or was it a negative change, or was it a neutral change? It's just like this is bizarre.
Yeah, I think it's pretty variable. It kind of depends
Mm.
on the day because there's times where I look at it and I'm like, okay, I like that jawline. And there's times, for some reason, with a camera, I cannot find a good angle now. And so when I look at pictures of myself now, I'm like, oh, I hate this. Like this is really awful. But in the mirror, it's different, which it always is, a mirror and a camera. And the other thing is, like we were talking earlier about how the muscles change. It's like my muscles might still continue to change and fill in because they've only been in this position so long. And like I don't have all my chewing strength back yet. And so eventually I think my jawline might even end up stronger and some things might change more. So I'm just kind of trying to reserve judgment now while I get used to it, basically.
When was the surgery?
Yeah.
When did this all take place?
Surgery was May 20th, so it's been about 8 months.
Oh,
Oh, wow.
I thought you were
Yeah.
gonna say like 3 years
yeah,
ago.
No.
me too. Wow. Yeah, so this is real fresh. Wow.
Yeah.
What would you say?
Before you ask that,
Yeah.
I wanted to ask. So did it work? Like, did it make especially with the looking at the 2 millimeter in your esophagus to what is now, like, did it fix? And does that feel different for you?
Yeah, so I'll probably have that imaging at my 1-year follow-up to get the new measurement of my airway and everything, but I'm told I don't snore anymore. I don't sleep with the CPAP anymore. I do find it easier to
Nice.
take pills. So I feel like I don't know if it'll be 11 meters or 11 millimeters like it should be, but I do think my airway is bigger. And my mouth opening, when I was having the trouble before surgery, it was 22 millimeters, which is not even big enough to take a scan for Invisalign. Like they can't even get the instrument in your mouth.
Wow.
And now I measured the other day and my opening's at about 39 millimeters, which is basically normal. So,
Right.
believe it or not, yeah, I mean, after all that, it worked, I would say.
Are you people up in those CrossFit wads with like the 1 mile runs now, or what?
Not yet, not yet. But it's been a lot of surgery. There's been some deconditioning there, but I'll get there.
Sweet.
What would you say is the biggest thing that TMJ has taken away from you?
Um, I mean, one of the things is just knowing my face, right? Like that's been something that's been hard to deal with, and it took away one whole summer. I mean, between recovering from surgery and then not being able to use my left eye, and like it took away, months of my life for sure.
What would you say it's given you?
Beautiful teeth. I mean, if it wasn't for my TMJ issues, I never would have had Invisalign. Like I didn't know I needed braces. I used to
Mm.
get compliments on my teeth. And now I'm like, oh, I had an overbite, I had crowding, I had this, I had that, I had whatever, and it's improved my dental hygiene immensely, being
Mm.
in Invisalign and all that. So it probably has given me a much nicer smile for several extra decades. So that's kind
There
of
you
nice.
go. There you
That's
go.
awesome.
Never bad to have nice chompers.
Yeah.
Well, Rachel, I mean, you, thank you. Thanks for coming on and giving us some insight into your experience. I mean, this is something that prior to this recording, like I don't think any of us had really any idea of like what TMJ even means. I mean, I had a good friend growing up, Michaela, who had TMJ, and again, like I just came at it from this idea of like, oh, you have like you have a short a short bite, like that, a lockjaw. To be able to really understand the impact that something like this can have on someone it's the entire reason why we do this show. So thank you for taking time to sit down with us and share your story. This has been really fun.
Yeah, thank you.